Did you know that unexplained itching in certain areas of your body could be a quiet warning sign from your body about cancer? Most people dismiss an occasional itch as nothing more than dry skin or irritation, but for adults over 60, persistent itchiness in very specific spots might be a signal you can't afford to ignore. In this video, we'll explore 5 particular areas where itching could be an early clue to cancer, sometimes months before any other symptoms show up. These aren't random itches, they're patterns doctors have repeatedly observed in patients later diagnosed with serious cancers like lymphoma, pancreatic cancer, breast cancer, and skin cancer. Stick with me till the end, because this isn't just about pointing out body parts. You'll learn why these areas itch, which cancers they may be linked to, and how to tell the difference between a simple skin issue and something more serious. By the time we're done, you'll know what signs to watch for, what questions to ask your doctor, and what steps to take if you recognize any of these symptoms. Most importantly, this isn't about causing alarm. It's about awareness. The earlier you spot these subtle signals, the better your chances of catching something early when treatment is easier. Let's get started. Sign 1. Persistent itching on the lower legs. If you're an older adult experiencing a persistent itch on your lower legs, especially your shins and calves, but you don't see any rash, dryness, or new products that might explain it, it's tempting to blame aging skin. However, this specific symptom has quietly appeared in many people later diagnosed with blood cancers like lymphoma. This isn't an itch that comes and goes. It sticks around, often worsens at night, and doesn't improve with lotions like typical dry skin does. This happens because cancers such as Hodgkin's lymphoma affect the lymphatic system, which plays a vital role in your body's immune defense and fluid drainage. As cancer cells multiply, they release inflammatory chemicals into the bloodstream. One common result is a deep, burning itch focused on the lower legs. Even if the skin looks perfectly normal, the nerves beneath are irritated from within. Take George, 75, who shared his story at a cancer awareness event. For almost 6 months, his only symptom was an uncontrollable itch on the front of his legs. His doctor first suspected eczema or a detergent allergy, but blood tests revealed abnormal white blood cell levels, and scans showed swollen lymph nodes in his chest, leading to a lymphoma diagnosis. The itch was the first sign, George said, long before anything else. Stories like George's are not uncommon. While an itchy leg doesn't always mean cancer, the key is how the skin responds or doesn't respond. If there's no rash, no new soaps or bug bites, and it lasts for weeks, it's time to look closer, especially if it comes with other subtle signs like night sweats, fatigue, or unexplained weight loss. For older adults, this kind of attention is crucial. As we age, our bodies may send less obvious distress signals. Pain might not show up immediately, and lumps could be deep, but nerves still react, and a deep, relentless itch may be one of the first signs. If you or someone you know has been scratching their legs night after night, applying creams with no relief, and wondering why nothing helps, don't ignore it. See a doctor. Ask about blood tests. Share the pattern you've noticed. Sometimes the body whispers long before it shouts, and listening can save lives. Sign 2. Itching between the shoulder blades or upper back. There's a specific kind of itch that shows up deep in the upper back, right between the shoulder blades, that's often ignored or blamed on posture, dry air, or even an old shirt tag. But for many older adults, persistent itching in this exact area, especially when it feels like it's coming from under the skin, has been linked to pancreatic cancer. And the strange thing is, it often appears months before any noticeable pain or digestive symptoms do. The connection might seem odd at first. How could an internal organ like the pancreas cause itchiness way up on the back? But here's how it works. When pancreatic tumors begin to grow, they can obstruct the bile ducts, those small tubes that help drain bile from the liver into the intestines. When this drainage slows or stops, bile salts start to accumulate in the bloodstream, And one of the first things those excess bile salts do is irritate nerve endings, often in areas like the back, where the body stores a dense network of sensory nerves. I remember a woman named Linda, 70, who told me she had what she called a phantom itch on her upper back. She'd wake up scratching it every night. Nothing helped. Lotions, back scratchers, even changing her mattress. She said it felt like it was coming from the inside. When she went in for blood work for unrelated fatigue, her liver enzymes came back elevated. That led to imaging scans, and eventually they found a small tumor in her pancreas pressing on the bile duct. The scary part, that itch was her only real symptom. No pain, no yellowing skin, just a deep, nagging sensation she couldn't shake. And the only reason she caught it early was because she spoke up, even when it felt like a small complaint. This is why that specific area matters. General back itchiness can come from dryness, pressure, or friction. But if the itch is focused, unrelenting, doesn't improve with skin treatments, especially if you also notice darker urine, pale stools, or fatigue, it may be a deeper sign of something happening internally. The back becomes the messenger, even when the problem is in the gut. For older adults, these kinds of subtle symptoms are easy to dismiss. We don't always want to sound dramatic, but your body is wiser than you think. And when it sends you the same signal again and again, it's worth listening, even if it's just an itch. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Sign 3. Itchy scalp without visible flakes or dandruff. An itchy scalp might not sound like a big deal. In fact, for many older adults, it's easy to chalk up to dry air, aging skin, or a shampoo that doesn't quite agree. But when the itching becomes persistent, especially when there's no dandruff, redness, or flaking, it can sometimes be an early sign of something deeper happening beneath the surface, including blood-related cancers like leukemia or skin cancers affecting the scalp. What makes this itch different is that it tends to feel more like a tingling, crawling, or burning sensation than just dryness. It may move around from one spot to another, and it often doesn't respond to typical treatments like anti-dandruff shampoos or moisturizing scalp oils. For people over 60, these kinds of sensations can indicate nerve irritation triggered by abnormal immune activity, something that occurs when leukemia cells begin to multiply in the blood and affect how the body regulates inflammation. There was a man named Henry, 73, who mentioned that his scalp had started itching every afternoon. He tried changing hair products, then thought maybe his hat was the issue. But even after switching shampoos and going hat-free, the itch remained. When he eventually got a full blood panel done for unrelated fatigue, doctors found abnormally high white blood cell counts. A bone marrow biopsy confirmed early-stage chronic lymphocytic leukemia. His scalp had been the first and only part of his body alerting him. What makes this especially important is that many older adults already experience some level of dryness or skin sensitivity. So when something like an itchy scalp starts to feel just normal, it gets ignored. But what sets cancer-related itch apart is how resistant it is. No cream helps. No product soothes it. It lingers, nags, and often feels disconnected from any surface problem. And while leukemia isn't the only concern, skin cancers that develop on the scalp, especially in areas with thinning hair, can begin as nothing more than a small, itchy patch. Sometimes it looks like dry skin or a small bump. But if it keeps itching, especially in the same place, and doesn't go away, it should be looked at under proper light by a dermatologist, because the scalp isn't always easy to examine on your own. It's helpful to ask a spouse, caregiver, or hairdresser to check the area regularly. If you feel an itch that hasn't budged in weeks, and it's not responding to anything you try, that's your sign to dig a little deeper. Especially if you've also been feeling more tired than usual, more bruised, or just off in a way you can't explain. It might feel like a small thing, but sometimes it's the small, stubborn things that tell the biggest story. Sign 4. Localized itching on the chest or breast area. When older adults, especially women, but also men, notice persistent itching on the chest or breast area, particularly around the nipple or just beneath the breast, it can be easy to attribute it to sweat, a snug shirt, or even age-related skin thinning. But this specific area is one of the most overlooked spots where itching may signal something far more serious: inflammatory breast cancer or other underlying tumors near the chest wall. What makes this sign unique is that it often shows up before any lump does. The skin might feel warm, irritated, or tight. Sometimes there's a change in texture, slightly rough, thicker than normal, or with a reddish tint. But just as often there's nothing to see, only a deep, persistent itch that never seems to go away no matter what cream or lotion is applied. I recall the story of Ruth, 69, who noticed an odd itching sensation around her right breast. She tried switching bras, she tried different detergents, she even went without a bra for a while thinking it was friction. But the itching continued, same spot, every day. When she finally went in for a checkup, her doctor noted slight skin dimpling and ordered further tests. What they found was a small but aggressive tumor growing close to the skin surface, without the typical round lump most people expect. This is one of the reasons inflammatory breast cancer can be so dangerous. It doesn't always follow the rules. It can mimic a skin rash. It can spread quickly, and the earliest symptom is often not pain, but irritation. That's why paying attention to itching that doesn't move around, doesn't ease with moisturizers, and is focused in the same place day after day, is so crucial, especially in the breast or chest area. For men, this can be even easier to miss. Male breast cancer is rare, but it does happen, and often goes undetected, because the signs don't match what most men think to look for: an itchy patch near the nipple, a small area of thickened skin, or a persistent twinge of discomfort under the chest muscle. Might not sound dramatic, but for someone in their 60s, 70s, or 80s, it deserves a closer look. And there's more. This kind of itch isn't always about cancer growing in the breast itself. It can also be caused by enlarged lymph nodes under the arms or just below the collarbone, signaling lymphoma or another nearby malignancy. So if the itch is accompanied by swelling, warmth, or even just a vague sense of heaviness in the area, don't wait. Early detection doesn't start with fancy machines. It all begins with awareness, paying attention, tuning in, and noticing those quiet, unusual patterns that don't quite fit. Your skin can't speak with words, but it definitely sends signals, and some of those signals are too important to ignore. If you're still with us and finding this information helpful, please drop a comment with number 4 below so I know you're here. And if you haven't subscribed yet, I highly recommend hitting that subscribe button and turning on notifications so you don't miss any future videos. Your support means we can keep creating valuable content to inform and inspire you. Now, let's continue. Sign 5. Persistent itching in the anal or genital area. Few things are more uncomfortable and more often overlooked than persistent itching in the anal or genital region. It's a sensitive topic, especially for older adults, and many prefer to ignore it rather than talk about it. But when itching in this area becomes chronic without an obvious cause like hygiene issues, infections, or irritation, it could be signaling something more serious. In some cases, ongoing itchiness here may be an early subtle symptom of anal vulvar or penile cancer. What makes this itch especially tricky is how easily it can be mistaken for something minor. Many assume it's dry skin, irritation from toilet paper, friction from walking, or a side effect of incontinence products. And often, that's true. But if the itch persists for weeks or months, returns despite cleaning or treatment, and starts to feel raw or burning beneath the surface, it deserves a thorough medical evaluation. Take Eugene, for example. A 76-year-old man who thought he was just dealing with hemorrhoid discomfort for nearly a year. He tried creams, changed his diet, and even used cold compresses, but the itch never fully disappeared. Finally, a specialist performed a scope exam and found a small lesion in his anal canal, an early-stage tumor that might have gone unnoticed until much later if he hadn't trusted his instincts. The same caution applies to women. Vulvar cancer is relatively rare, but becomes more common after age 60. One of its earliest signs can be persistent itching on or near the outer genital area. There might not be a lump, but the skin could start to feel rougher, thinner, or slightly discolored. Many older women assume these symptoms are hormonal or related to menopause, and sometimes they are, but if the itch is relentless, worsens at night, and doesn't respond to typical treatments, it's important not to ignore it. This region is packed with nerve endings and highly sensitive, which means it often signals internal changes before anything more obvious appears. Whether it's skin cell changes, nerve inflammation, or swollen lymph nodes nearby, chronic itching, especially if it's only on one side or in a small focused spot, can be a warning sign. Still, many hesitate to speak up, worried about embarrassment or overreacting, but staying silent is riskier than asking for help. Talking to your doctor about a persistent itch could lead to early detection, better treatment options, and peace of mind. The key message here: if an itch won't go away, don't assume it's normal. Get it checked out. Early detection, especially for something as serious as cancer, often begins with noticing a small, subtle symptom and deciding not to ignore it. Final thoughts. As we wrap up, here's one simple truth. Your body is always communicating. Sometimes it speaks through pain or fatigue, but often it starts with something small, subtle, like a persistent itch that won't quit. The 5 areas we covered today, the lower legs, upper back, scalp, chest, and genital region, aren't random. These are places where serious internal issues, including some cancers, often send their first quiet signals. For older adults especially, learning to recognize and listen to those signals can make the difference between catching something early and letting it silently progress. You don't need to live in fear. That's not what this is about. It's about empowerment, reminding you that your instincts matter, and that small symptoms may be your body's way of asking for help. If any of this sounds familiar, don't brush it aside. Talk to your doctor. Start the conversation, because you deserve clear answers and peace of mind. Thank you for spending time with us today. We'd love to hear from you. Leave a comment below sharing one thing you learned and how you plan to use it. Your input is important and motivates us to keep creating valuable content. If you found this video helpful, please like, subscribe, and share. Your support helps us keep making content that informs and inspires. Thanks for watching. We'll see you in the next video.